Dr. Ali Krisht. I'm the director of the Arkansas Neuroscience Institute. We're going to go over a tour to show you our facility and at the same time to give you the scope of our institute and the vision we have for its future. And this is a piece of art actually which was made by an Arkansan and simulating the different structures of the brain in a way. Our center was a product of a vision of establishing a world-recognized center for treating diseases related to the brain and spinal cord, which is a scope of the neuroscience specialty. At the same time, to have a research component and educational component of it. And this is an auditorium which has unique features. It is connected with two 3D projectors which you can see up there, and these are connected directly to two of our operating rooms. This is a complete immersion because you're able to see exactly what the surgeon, myself, or anyone who's operating is seeing. So you are like inside the operating room and it gives you the full experience. So this is our laboratory, and it has stations which can accommodate up to 44 participants, where they will be operating in a simulation like being in the operating room live in a way. And this is our director, Dr. Aboud. He is also the innovator of what we call the Aboud model. This is a unique model where you can do surgery on cadavers like it's live. This is our new clinic as well, where it is tailored in a way to preserve privacy of patient and to give them a lot of comfort, and at the same time to have a smooth flow, because in normal hours it's a very busy place. At any one clinic we usually have about 40 to 50 patients that are seen in one day. So this is the hospital part of our vision, where our patients are taken care of in the Arkansas Neuroscience Institute clinical side. This is a hospital which has been renovated, so it has state-of-the-art facilities to be able to perform neurosurgical procedures and take care of patients with neurological problems in the most advanced level. Our patients are referred from across the different corners of the state as well as from the surrounding states of Arkansas, and this is why it was important to have a helicopter pad, because of our programs of trying to treat patients as soon as possible. We established a very well connected network with all the emergency rooms in the state. And the uniqueness of our campus is that the hospital is connected to the rehab facility next to it. So if a patient needs rehab, then they are transferred to the rehab facility and they're close to us if anything comes up. So this is really a nice package. It's like a one-stop shop for patients, which is a unique aspect of what we have. This is the MRI suite. We have 2 MRIs, we have 2 CT scanners, so that when we have a busy traffic day where we have a lot of emergencies coming at the same time, our patients are coming in on an elective basis, there is no traffic at all. There is always a smooth flow of activities. This is our ICU, which is part of our renovation project for the hospital. Each ICU is prepared to handle patients with neurological problems, whether it is head trauma or ruptured aneurysm, patient with strokes, or major complex spine procedures. So this is our operating room facility, which is a state-of-the-art, equipped with the most recent and anything that's needed for patients to be taken care of at their best in a way. And that's what's unique, that we have patients that come actually not only from Arkansas, but from around the nation and from around the world to the Arkansas Neuroscience Institute because they know that If there is anything that can still be done more, it will be in our facility. So all the nurses and techs working in our operating room are dedicated to take care of our patients, which is one specialty. So they are really highly specialized, and with our continuous education process, they are providing the best help you can have in the operating room. The Arkansas Neuroscience Institute was a vision, and now it's a reality. As you have seen, this is a campus which has the whole cycle of patient care that starts with the clinics where we see our patients, and the building where the best team in the world can take care of the most complex cases. Our main goal is not to give up on every single patient. We don't like to play the statistics game. If we're successful in 95% of the times, we can easily convince ourselves that we have done well. But to us, the 5% is as important as the 95%, and we don't like to give up on any of our patients.